Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we are going to talk about how you should understand your specific situation and the triggers that are impacting you. You see, I have a lot of people that have tried a lot of things. And when they first come to me, they oftentimes will say, I've tried this, I've tried that, and that didn't work. One of the things that comes to mind in particular, for example, is diet. I've tried these diet changes in the past that didn't seem to do anything. I've tried eliminating gluten or dairy, sugar, caffeine, whatever it may be, and it didn't seem to have an impact on their symptoms at the time. And so they sort of put it into a category of that's not my problem. Okay. And maybe hormones can fit into that, maybe barometric pressure changes, stress, whatever it may be. And so it's very, very common for people to journal, try to understand what their triggers are, and then go down this journey to avoid those, eliminate those, reduce them, change them, whatever they're able to control about the information they find. Now, there's a percentage of people that don't find any connection, and they're just sort of frustrated because I don't know what's going on. Nothing seems to be a consistent pattern, and they sort of like throw up their hands with this sense of, well, if nothing seems to connect to my symptoms, I don't know what to do. And so what happens is, because let's take diet, for example, if the diet changes don't impact the frequency or the intensity of their symptoms, if it doesn't lead to any improvement, then they'll go back to just, eating whatever, or they're not going to stick with whatever diet change they were trialing, or removing whatever specific food it may be. And so it becomes this sort of frustration because they can't find the one thing. So there's a couple of things that I want to break down here, and so I want to break down this idea of finding the one thing, because we shouldn't just be searching for one thing necessarily. And what it's going to do is lead us into this framework that we use here at Novarius Headache Center. You've heard me talk about it before. It's a 3-spoke framework. It's a framework where we take what is true about our bodies, what's true about physics, what's true about how we experience pain, about how our GI system works, about inflammation in our body. We take these things that we know to be true, and we pursue this journey of being healthy. And when we pursue that journey and we sort of disassociate that journey from, okay, I need to see some result as it relates to my headache or migraine, I think we're going to actually end up seeing results at some point, but it's going to be a lot healthier way of understanding, okay, what is a trigger? What is my body really sensitive to? Because if we back up and we look at just everyone in general and how our bodies respond and what's true about our anatomy, we understand that these principles that we want to follow are going to be good and healthy for just about anyone, all right? And so if someone's in chronic pain, we need to get all of these body systems working as effectively as possible. We need to get all the systems running efficiently, and so we can be as healthy as possible so that we can deal with chronic pain. So whether it's exercise, diet, mental stress, mental ability to cope with the pain you're dealing with, like all of these faculties in our body need to be optimally functioning. So one of the things that brings up this specific topic is a conversation with a patient recently where we were talking about, okay, if we want to take another step into this healing journey, what would that look like? And I encouraged her to look at diet and maybe trying to make some changes. What had happened was she had gone on vacation, diet had changed. With that was also travel, maybe some different sleeping positions or different pillow setup. So her neck may have been under some more stress, but also like her diet had changed, and so her body may have been sensitive to that. And the response was, well, I've tried diet changes in the past, and they didn't really do anything. It didn't really impact my situation. And then if you go back and listen to the podcast episode where I interview Elizabeth Post, it's probably a year ago or so, but Elizabeth's situation is interesting. And I think going through her case and helping her and treating her, I realized that because Elizabeth had tried eliminating gluten, eliminating dairy, she had tried different diets to help with her migraines. And they hadn't worked. They didn't change her situation at all. And that was before she came to see us. And then what happened was we started treating her, and we go through the treatment process, and she's seeing some relief. And then we have this conversation of, hey, Elizabeth, let's just take a few steps in the direction of just general health, as opposed to us just working on you. Let's see what we can do as far as like diet. And so she went, and it was kind of this like, well, it hasn't really worked in the past, but I'll try it. And so she goes back to eliminating gluten, and then I think reducing sugar intake, and she feels better. And now she realizes that if she has gluten, she'll like immediately get a headache, or at least it's a close association to that. But her body wasn't experiencing that before. Okay, so before she came to see us, she didn't really see this connection because it was just like the pain was always there. Eliminating gluten didn't really change anything. Eliminating dairy didn't change anything. And so it took us working on her to then allow her body to respond to the gluten or the dairy. So what is happening here? So my interview with Elizabeth, I think we hit on it, but thinking back on her case, this was super insightful, and it helped me in having this conversation with this other patient, because I think there was a time in my career where I would have said, okay, if you've tried the diets in the past, they didn't really change anything, like that's fine. That's probably not the issue. Well, I don't say that now, and that's not what I said in this situation, because the first scenario that I laid out was this idea that pursuing like an improvement in your diet is going to be helpful really no matter what. So asking like, is this good for me or not, shouldn't really be the question, because we know the answer. It's yes. Like improving your diet, reducing the things that we know to be inflammatory when someone's in chronic pain. Yeah, we should pursue those things and not necessarily expect an immediate impact. The idea there is you're helping your body to provide the right environment where it can then increase your threshold. So the last podcast, we talked about threshold and triggers and how the source of pain can fluctuate, but then you have this threshold line that can drop. And so with certain foods, gluten, dairy, sugar, caffeine, whatever it is, that can drop your threshold. Okay. Now in this scenario, like Elizabeth's story, and then this other patient, like her, the likelihood that the tension line, the actual source of pain, the irritation in the neck, was just so high that even if you eliminated gluten, dairy, sugar, and it helped, like it objectively helped, but your threshold wasn't high enough for you to feel the difference, because the tension in your neck was just, it was way too loud. Like it needed to calm down for you to be aware of the changes that were happening and the benefits you were getting out of those diet changes. So I hope that makes sense. It's this idea of the threshold being one element of what you're experiencing, but then the actual source of pain. And if you have not addressed the neck at all, or the jaw or the shoulders, the physical side, the actual thing that's causing your pain, and your pain level is like the noisiness of that signal is just so high, then the triggers might not make any sense. Like you might be all over the place. You're like, I can't figure anything out. It just seems like it happens in the morning. It happens in the evening. It happens at 2:00. It happens when I sleep. It happens when I take a nap. It happens with barometric pressure or hormones. But then it happens. Then it doesn't happen with those things. And so you might be really confused at what's happening. But it's probably just the angriness, noisiness of the source of pain that's really driving those symptoms, even though your body is having the same response that anyone else would to those other things that impact your threshold. Okay. So, what's helpful in this conversation, and what I wanted to relay to you, the listener, is if you are searching for the trigger, if you're going down the trigger approach and you're trying to understand what should I avoid, and especially if it's like diet or something like that. Obviously, it would be great if we saw a connection in a reduction of your headache or your migraine symptoms. Okay. Now, you may not get it though. You may not get it because we also need to address the neck itself. We need to address the source of pain. And so going down this road of improving your diet is a worthy journey, okay? And what I would encourage you to do is pursue those efforts, whether it's avoiding triggers, changing your diet, hormones, stress levels, whatever it may be, those things in the threshold trigger category. I would encourage you to pursue those with the expectation that I'm going to make these changes in a way that allow me to put these behaviors and practices in place long term, okay? Maybe it's just in moderation. You're always considering those things. So if you can move, if you can exercise, if you can, and then if you can eat right, eat well, whole foods, avoid fast foods, reduce your sugar intake, pay attention to how much caffeine you're consuming, things like that. Long term, okay, so what is sustainable for you in that scenario? Instead of doing maybe an extreme diet for a short period of time and saying, well, that didn't work, and then sort of like going back to, I don't want to say like not caring. There may be some people in that category where they really like their diet's all over the place. But the idea is to just be mindful and pursue those things for the sake of being healthy. And then don't necessarily grade them or evaluate them based on how your headache or your migraine symptoms respond to it, because there's other factors involved. Okay? So the other thing in this scenario is when people say, when they talk about, so I'm going to go on a little tangent. I'm going to back up. When I opened Novera, I had already been treating people with headaches and migraines, and they were all getting better. It was like 100% success rate, and it was just amazing. And if I do this in a setting and it's a headache center and people start talking about it, like that word of mouth will work really, really effectively. People just sharing their stories of like, I had these migraines and they went away. What I found was it didn't quite work that way. And I think what happens is we have a lot of people that have gone through our process and they love us and they talk about us. You listening to this may be one of those people. And maybe you can relate to this scenario, but you go and you tell someone, hey, like this place really helped me. And they could help you too. And then the person will ask like potentially something like, well, tell me about your scenario, or what were your headaches like? What were your migraines like? And even if they don't ask that, I can almost guarantee you they're going to tell themselves a story in their own head that says, well, my situation's different, okay? My situation's different because I have barometric pressure headaches, or I have hormonal headaches, or I have stress-related headaches, or my headaches are connected to exercise, or my headaches are in the morning, or they start at night, or my migraines come, but they don't have an aura, or I don't get the nausea, or mine have dizziness, and mine are only once a month. Mine aren't 2 to 3 times a month, or every week. And so like everyone's scenario is different. And I think what happens is people will try to compare their situation to someone else's, and it's almost never going to match up. Like it's not going to be like your story is exactly their story. And what's happening there is that our bodies are having this experience. And there's all these different variables. So the neck, the jaw, the shoulders, everyone's symptoms present, like the level of tension and where it's tight and the irritation in those areas is different for everyone. And so where the pain's referred to, how the brain interprets it, what symptoms you have with that, whether it's sensitivities to lights and sounds, the nausea, the dizziness, ear fullness, ear pressure, ear ringing, like all those are going to be different, even though the underlying problem is we need to get things functioning as they should. Like that's going to be the common thread, regardless of like how those symptoms are presenting. And then you have the other side of it where some people might be really like sensitive to certain food groups. Others might be sensitive to barometric pressure changes. Others might have more hormonal triggers. And so all of those things are true for everyone. Like everyone's body's responding to all those things. But some people might be more sensitive to certain ones as opposed to others. Okay, so then we have to take all that, and instead of getting caught in the weeds, which I would say like our healthcare system does, because there's like 1,000 different diagnoses for different types of headaches and migraines, and they all have different recommendations. And do this if you have a left temple pain that occurs on every second Tuesday of the month, and then you also get dizzy. Like it's just, then there's a specific diagnosis for that, and you need this medication. Like it gets kind of crazy, but all roads lead to like some medication that's supposed to mask symptoms. And so it's really not like all that, like they're reflecting back on you in medical terms what you just told them. Like they're not finding anything objective and treating it. But if we're going to find something objective, the common thread that causes all of these symptoms, it can cause all these symptoms, are these upper neck problems and the jaw issues and the shoulder problems that are being overlooked. And so what we need to do, if we back up, we need to apply a framework where like we just say what we know is true. And it's not like, when we work with people with headaches and migraines, it's like, well, will it work for me? It's like, well, do you have a neck? Like, does your body function the way the rest of our bodies function? And if it's like, well, yeah, of course, then we're just going to apply what we know to be healthy. And we're going to apply that to you. And then we're just going to go on this journey and it should work. It's kind of like, I mean, if you want to lose weight, and it's like, well, will stopping eating McDonald's work for me? I don't know. Like, yeah, like you could probably try 100 different diets. But the idea of like calorie expenditure and calorie intake, like that equation needs to shift. I mean, there's nuances to it. But it's just like, if you back up and you just apply the basic principles of movement, restoring function, looking at, okay, how are we healthy on the diet side and the hormone side? That's how we came up with this 3-spoke framework when we say, okay, we want to address the source of the pain, the thing that's actually causing your headache and migraine. And then we want to look at any developmental factors that might be preventing you from finding the release of tension that you're looking for. That's when we have providers like that talk about airway or tongue ties or things like that. And then we also want to look at functionally or systemically throughout your body, like what level of inflammation do you have and how can we impact that? And that's going to be through diet or hormones, like talking to Dr. Leora or Nathan Morris or Jeff Hunter, like these providers that really understand the systemic side of things and how to reduce inflammation. And then if we apply that framework, it's like, man, we can help anyone. I mean, anyone with a headache or migraine. Like I said, if you have a neck and if you have a jaw and if you have shoulders and if you have headaches or migraines, like, yeah, you qualify. Like any type of head or facial pain that hasn't been solved by our healthcare system. And usually that's, if they do the scan and they find the thing, then they treat it. But 95% of the time, 99% of the time, they're not going to find anything. And then it leaves you sort of wondering, okay, well, what do I do? And if you're tired of the meds, let's apply this framework and see if it works. And it's not, I shouldn't say see if it works. Like it's just, like I said, it's physics. It's just understanding the anatomy, understanding what the body, how it should function, and then restoring it. And that's what I love what I do, because it sort of takes the guesswork out of it. And we've seen it work over and over again with hundreds, over 1,000 people now that have gone through our process. And it's just a lot of fun. It's fun because it gets people off of meds. You feel better. You get your life back. and you have a sense of control. Like you understand what's happening and you can do something with it. Because that anxiety or stress that pops up when, man, I have no control over this and I don't know when it's going to happen. I don't know what day it's going to interrupt. That's terrible. It's terrible. We need to stop that. So there you go. That's my answer to a question. Maybe you asked it, maybe you didn't, but people here are asking it of like, well, I tried changing my diet at one point, didn't really do anything. So that's not really for me. No, we have to look at it with the sense of what is healthy, pursue that in a way that's sustainable, understanding that it's the things that impact our threshold need to be considered along with the things that impact the actual source of pain. And if we use that 3-spoke framework, that model, and we just continue on that journey, relief should come. Thank you guys so much for listening to the Headache Doctor podcast. As I always say, share this episode. Give us feedback. If you want to email us at hello@noveraheadachecenter.com, that'd be fantastic. Ask questions, other topics. Follow us on Instagram at Novera Headache Center or TikTok, the Headache Doctor, and interact with us there. As always, on this podcast, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. We'll see you next week.